Good afternoon, and I apologize for being a couple minutes late today. Thank you for joining us. I'm Dr. Martha Buchanan, the Health Officer and Director of the Knox County Health Department. For a moment of gratitude today, we want to focus on our faith community. This weekend is a really significant weekend for many faiths. And we understand that it's going to be very difficult to not gather together physically as they traditionally would. But what we want to thank them for is for the creative ways they're coming up with to gather together spiritually and emotionally and socially without being physically close together. So we applaud their creativity to continue their traditions and hope that everybody will feel that as they gather in virtual ways across the country and across our community. Moving into our local situation. We have 152 confirmed cases of COVID-19 in Knox County. 106 of those have recovered. 19 individuals have been hospitalized at some point during their illness. There was an additional death from COVID-19 in Knox County. And so somebody died from COVID-19 while they were here. But because we are investigating the residency of that person, we will not be counting it on the Knox County numbers today. And we're telling you this because it may appear in Tennessee Department of Health's numbers this afternoon. And part of the reason is that the Tennessee Department of Health gets a large volume of information about COVID-19, including deaths and test results. And then the local jurisdictions look into those and look into that data more carefully. And in our investigation, we are attempting to confirm the residency of the person who died, and that might change where this person gets counted as a death from COVID-19. Regarding testing and testing availability, it continues to increase throughout the community. We're happy about that. We recommend people call their primary care physician to see if they can get tested there. There are also lots of walk-in clinics that are doing testing as well. We have a list of those clinics through our phone bank that can be reached at 865-215-5555. So if your primary care doctor is not testing and you want to maybe go to a walk-in clinic, give us a call. We can help you find one that's close to you that is testing. Additionally, we, the Knox County Health Department, continue to test 5 days a week. And we're testing those who meet our clinical guidelines. As we have shared before, we want people to call us first and make an appointment. We can do testing in a variety of ways, including drive-through when that works for the person. We're also going to be expanding our access to testing beginning Monday, increasing the total number of people we can test each day. We know access to testing is important. We know testing and knowing who's got COVID-19 and who doesn't have COVID-19 in our community helps all of us understand this illness better and helps us as public health do our job to help protect the rest of the community. Again, I remind you, you still have to call us, set up that appointment. Speaking of calling us, our phone bank will be open regular hours Friday and Saturday. And then on Sunday, we will not have the phone bank open so that those people working the phone bank can go spend some time with their families for the Easter holiday. However, outside the phone bank, the rest of our COVID-19 response efforts will continue over the weekend and including Sunday. Another note about testing. We know there are lots of new tests out there, and that's great. We really applaud the innovation of companies creating new ways to test, faster ways to test, but we want to urge our providers here locally to carefully vet or investigate any testing that might be offered and make sure it's FDA approved. Our Tennessee Department of Health lab can help answer questions about that, but we want to use valid tests to determine if somebody has COVID-19, not just in Knox County, but across the country. And now I'll open it up for questions.
The first question we have is from WVLT. They ask, has every hospital in the Knox County area had a positive COVID-19 case?
We don't release hospital-specific data on cases of infectious diseases. Hospitals would have that information.
From the Knoxville News Sentinel, they say we are seeking clarification on the number of patients who can be treated during a surge. Yesterday, Dr. Keith Gray said hospitals can surge up to treat some 4,000 patients, and now we're being told that number is more like 5,000. Can you explain these figures?
Sure, that's a great question. The 4,000 is in addition to existing beds. So we already have existing beds. We can surge up to 4,000 more beds, is my understanding. We clarified this with Dr. Gray yesterday. So I hope that helps answer that question.
They've also asked, do these figures account only for hospitals in Knox County?
This is a regional look. As you know, Covenant Health has footprint throughout the region, as does Tenova. So these are regional numbers.
A question also from the Knoxville News Sentinel. They say the state, it seems, has taken the Knoxville Expo Center off the table, but is now looking at Knoxville Center Mall as a potential overflow site. What input, if any, did the Knox County Health Department have in this decision?
Well, as we spoke about and as you learned about yesterday, we have a task force looking at alternative care site that includes our hospital systems, the city, the regional health office, Knox County Health Department, the county. So lots of folks involved in that. They're working together with the state to look at alternative care site options for Knox County and the region.
His follow-up here was, can you explain the reasoning behind the switch as well as how far along the assessment of the mall may be?
So that assessment and those decisions are being made with TEMA and the Army Corps of Engineers. So those folks would have the details of how that decision is made and how they're making those, what guidelines they're using.
Question from WBIR. Seems to be good news about Expo Center not necessarily being needed as additional hospital capacity. Is that because of social distancing? Would our situation be worse if we had not put these social distance measures in place?
Hey, that's a great question and an opportunity for us to thank our community for abiding by our social distancing guidelines and staying home, keeping themselves and our community safe. Remember, staying home and reducing trips is a way not just to keep yourself safe, but to keep our whole community safe. And yes, we believe that the change in the trajectory or the number of cases we're getting each day is because our community is abiding by social distancing. That means to keep those things in place. We need to keep going that direction. Slowing down the pace of cases is what we want to do. That's what we've been talking about. We're doing it together because it takes all of us to do this.
From the Compass, the U.S. Army Corps of Engineers has decided not to renovate the Expo Center as an alternate care site because of lower projections. The Corps is still evaluating sites, but the Expo Center is not being considered anymore. Do you know why?
So the Army Corps of Engineers is working independently, communicating with our task force. They're making those decisions based on guidelines that they have for where they want to have a facility. And I do know that they are in their planning or prioritizing Nashville and Memphis. I'm aware of that as they have more cases than we do right now.
From WATE, what numbers changed in terms of the decision to not renovate the Expo Center as an alternate care site?
Well, I think based on what I've read, the modeling that the state is using is showing fewer cases in Knox County. And I'll go back to remind everybody that social distancing is part of the reason we're showing fewer cases in Knox County. And it's a great question to ask TEMA and the Army Corps of Engineers as they are looking at sites across the state.
From WBIR, new rapid testing coming to our area promises results within 5 minutes for positive tests, 13 minutes for negative. Are there concerns that this faster test may not be as accurate or involve more false negatives?
So we know that new tests that come online in the United States do go through some vetting with the FDA. We also know that the FDA has approved a faster route of testing approval for COVID-19 specifically. I'm aware that there are some tests that have gone through that approval process. The FDA and the CDC believe they're accurate and useful. But even when they roll them out, they continue to have testing, additional checks to make sure they're accurate so that we know when we get a positive, it's a positive. When we get a negative, it's a negative. And the other piece to that is we encourage, just like we do in flu season, we encourage our providers to use their clinical judgment. If the person in front of you looks like they have COVID-19, we have COVID-19 in our community. If they look like they have COVID-19 and the test says it's negative, I think you need to look at that person in front of you, use your clinical judgment, and advise them appropriately.
The follow-up to that question, which I think you spoke on here, but Cole, feel free to let us know if you'd like us to expand, is this one of the less valid tests that you spoke about at the start?
I really, since that testing approval happens at the federal level, we don't have any information about the validity of specific tests.
From WATE, can you give us any more information on the demographic of the 84-year-old man who died yesterday? Did he have underlying conditions?
We are not going to release any more patient-specific data.
And they've asked regarding the new death today, why is there a question regarding the residency of that person?
We just learned about it, so I actually would have to, my staff are still looking into that.
You want to talk a little bit about the testing versus the information gleaned from testing versus gleaned from case investigation, so that it's possible to know point of care, but maybe not point of residency. I think there's an additional clarity that they need there.
Okay, I'll do my best. People, we travel, people are still traveling. And so people might get tested in Knox County, but not live in Knox County. And we don't always have all of that information because we may not have even been the place to, we did not perform the test, so we don't have the information about that person. So we have to gather more information. What we know is a person died while in Knox County of COVID-19. Now we have to look into the specifics about that person. And that's our job as public health. So we don't get the report directly, and we'll have more information tomorrow.
From News Talk 98.7, can you offer info regarding the report of an employee at a busy home improvement store being diagnosed with COVID? How concerning is this?
Again, we don't release patient-specific data. A little bit about how we operate in public health. If somebody's diagnosed with any infectious disease, but we're specifically talking about COVID-19, we reach out to that person, learn about where they work. We reach out to that employer if we need to, get very specific information about when they worked, who they might have come in contact with, and then we reach out to those individuals and let them know that they might have been exposed, and use those routes, direct communication to those people at risk to inform them and advise them on what they should do.
From WBIR, one of our viewers asks, I've heard people who die from COVID-19 may be coded as caused by pneumonia or other coronavirus complications, leading to misleading COVID death numbers. Is this true?
So what we have to rely on our medical professionals to put the information that's accurate onto the death certificates in order to be able to count cases as COVID-19 deaths. And we trust them to make those decisions. They do it all the time. And just like flu, most people who die from COVID-19 are going to die from complications. So it's rare that they die from the virus itself. It's the complications from the virus.
From WUOT, you mentioned earlier that KCHD will have expanded testing capability on Monday. Can you give details about the number of new tests that you will have next week? And will you have any of the Abbott rapid testing machines at the health department?
Don't know about the Abbott rapid testing machines. I don't think that we're getting those. I think those are being shared or used at the Tennessee Department of Health Lab. Actually, my staff is still working on how can we increase our capacity and what that exactly looks like. I'll be talking with them either later today or tomorrow to learn more about how many people we hope will be able to test each day going forward.
Any other questions? Please go ahead and submit them in the chat feature. Okay, from WBIR, back when we began these briefings, we talked about the risk of COVID-19 still being low for most in Knox County. Is it still? And how does it compare to flu in terms of risk and spread now?
So the risk in Knox County is definitely higher than it was when we started all of this. We have, now I'm blank, oh, wait, it's on my piece of paper. We have several cases, 152 confirmed cases that we know of. We probably have cases that we don't know of, because remember, about 80% of people that get COVID-19 won't even seek care. They'll just be mildly ill. I think the big difference between this and flu is the level of contagiousness. That's even a word. So it's so much easier. If I have COVID-19, it's so much easier for me to pass it to several people because nobody has immunity to it. It's new to us. Our immune systems haven't seen it before. We have no like leftover immune memory and antibodies to fight it with. So all of us are susceptible to it. Unlike the flu, some of us are less susceptible to the flu because we've gotten vaccine or because we've had it in the past. We don't have that immunity. So it's so much easier to pass. So it is easier for folks to get, which is why it's so important. Keep saying it. Go out only when you need to, stay home, especially stay home if you're sick. Please do not go out and expose others to COVID-19 when you're sick. Avoid visiting sick people. Wash your hands a lot. Try to avoid touching your face and nose, and that's really hard to do. Now the current recommendation is if you're not able to observe social distancing, trying to keep 6 feet between yourself and other people, the recommendation now is when you go out in public, wear a mask, like to the grocery store, the pharmacy, where that might not be possible.
From the Compass, at City Council's meeting on Tuesday, a question arose about the county's use of motels as an isolation place for patients without a known address. Please explain the program and whether any COVID-19 patients have been isolated in a hotel. He goes on to say the program as described indicated the county uses this program for any illness that would require isolation.
Yeah, so we do sometimes for people who don't have a home, a place to isolate. We do sometimes use hotels for that. We're really grateful for the hotels to allow us to do that. And we have had to house some homeless COVID-19 people in a hotel. And it's something that we do with TB patients, not irregularly. So it happens a couple times a year. So it's a method that we use because when we need to isolate somebody, if they don't have a home, we got to help them find a place to isolate. And we make sure that there's no risk to other people who might be there. People are in isolation in that one place. We make limitations on who can go in and out of the room, and the hotels are very cooperative, as are the patients.
Any additional questions, please submit them in the chat feature now. Another question from the Compass. Do you know how many COVID-19 patients have been housed at the hotels?
Okay, so yeah, 2 different reasons to have to house people who don't have a home. People who are in isolation. So anybody who gets tested for COVID-19 needs to stay in isolation until their test results get back. So we have had some homeless folks that were waiting for their test results to come back that we did have to house in a hotel. However, on Monday, the guest house opened thanks to the city and VMC and multiple other partners. And now we're able to house those folks back in a more central location. So we're able to house those folks there. So we're housing folks who are waiting for tests and folks who are positive.
All right, any additional questions? Please go ahead and submit them now. All right, thank you everybody. We appreciate it, and we will see you at 12:30 tomorrow.